Dear colleagues, my name is Professor Natalia Linkova. I am the head expert consultant of Peptides company. And today the theme of our lecture is dogs and cats, our pets. Let's keep them healthy with the help of peptide bioregulators. With the development of society and the improvement of people's quality of life, more and more families are getting pets, among which dogs and cats predominate. According to the American Pet Products Association report, by 2021, 17% of Americans' household had pets. Owning a pet has a positive effect on a person's mental and physical health. There is a worldwide trend of pet owners treating dogs and cats as family members. Since dogs and cats have become an important part of our life, maintaining their health is very important. A peptide and non-peptide bioregulators are an innovative tool for maintaining and improving health. They control many physiological processes in human body, which allows them to be used for therapeutic and preventive purposes. Considering that the pathogenesis of disease in human and animals is largely similar and bioregulators usually undergo preclinical studies on animals. They can be considered and promising drugs in veterinary medicine. The most common diseases in dogs and cats that require treatment and prevention are inflammatory bowel disease, kidney disease, neoplasms or tumors, and disease of the musculoskeletal system. At first, we can talk about the general scheme of application of lingual peptide bioregulators in complex treatment of dogs and cats. The dosage of lingual in the form of drops peptide bioregulators is selected depending on the weight of the animal, dog or cat, and is suitable for both small and large pets. If necessary, the dosage and frequency of administration can be increased. Up to 5 kilograms, we can use 2 or 5 drops 1-2 times a day. From animals from 5 kilograms to 10 kilograms, we can use 5-10 drops 1-2 times a day. From animals from 11 to 25 kilograms, we can use 10-20 drops 1-2 times a day. From 26 to 16 kilograms, we can use 10 or 20 drops 2-3 times a day. And for animals more than 16 kilograms, we can use 15-13 drops 1-3 times a day. All peptide bioregulators can be added to the animal's soft food. It is important to ensure that the animal has completely eaten the food and received the required dosage of the peptide. The course of taking the drugs is from 1 to 6 months, depending on the severity of the condition. To maintain the health effect and prevent lapse of the disease, it's recommended to repeat the treatment after 1 or 3 months. 1 milliliter or 20 drops on the lingual peptide bioregulator contains 0.1 milligrams of the peptide and as activate substance in the form of lyophilized dry powder. 2 drops of the lingual peptide bioregulator contain 10 milligrams of the active substance. For animals in preclinical studies, the effective active dosage was determined as 10 micrograms per 1 kilogram of body weight. So we have general scheme of application of peptide bioregulators in capsules in complex treatment of dogs and cats. For large dogs and cats, peptide bioregulators can be used in capsules. One capsule contains 0.1 mg of the active substance of peptides. The dosage of peptide bioregulators in capsules here and below is selected depending on the weight of the animal, dogs or cats. Up to 10 kilograms, one capsule every other day or once every 3 days. From 11 to 25 kilograms, 1 or 2 capsules once a day. From 26 to 16 kilograms, 1 or 2 capsules 1 or 2 times a day. And more than 16 kilograms, we can use 1 or 3 capsules 3 times a day. So at first I will tell you about inflammatory bowel disease in dogs and cats, IBD. It's multifactorial diseases of animals characterized by chronic enteropathies, constant of recurrent inflammation of the gastrointestinal tract. The exact etiology of IBD is unknown. It's believed that factors associated with gastrointestinal inflammation have genetic and external causes, for example, nutrition and ecology. To confirm the diagnosis of IBD and determine the stage of the disease, an endoscopic examination with a biopsy of the mucous membrane of the gastrointestinal tract is necessary. Treatment of IBD is associated with numerous difficulties due to the unclear etiology. Clinical signs of IBD is vomiting, diarrhea, blood in stool, weight loss, and loss of appetite. Endoscopic abdominates of IBD is looseness, increased gravitality, erosions of the mucous membrane of the gastrointestinal tract. The state of the local immune system of the mucous membranes of the gastrointestinal tract organs plays an important role in maintaining of the functions of the gastrointestinal tract in animals. Immunoprotectin will contribute to the progress in the treatment of this group of pathologies. So we have some peptides bioregulators for the prevention and treatment of inflammatory bowel disease in dogs and cats. The first is Hanluten. It's EDG tripeptide, a dietary supplement that can be used in cats and dogs in form of sublingual drops. Hanluten is recommended for the prevention and maintenance therapy of gastrointestinal disease in humans with gastritis and gastric ulcer, healing of gastric mucosal defects, prevention of stomach cancer, heartburn, and other digestive disorders. Hanluten heals gastric ulcers in Sprague-Dawley rats in the experiment. On the 21st day after the ulcer appeared, its complete healing or epithelialization was observed. Hanluten normalized the synthesis of signal molecules like eNOS, CNOS, HSP17, NF-kappa B, and P65 in the gastric epithelium. Hanluten reduced the expression of mRNA of the TNF-alpha, SOT, and COX-2 genes in gastric epithelial cells to the normal level, and Hanluten normalized the expression of cytokine genes and antioxidant enzyme. This underlines its reparative effect of gastric ulcer. The next peptide is Stomacort. It's a polypeptide complex obtained by extraction from the gastric mucosa of young animals, a biologically active food supplement that can be used in cats and dogs in the form of drops under the tongue. Stomachort is recommended for people for the prevention and maintenance therapy of gastrointestinal disease, gastritis and gastric ulcers, healing of gastric mucosa defects, and other. The effect of stomachort on the formation of gastric erosives in the model of acute immobilization stress in rats was studied. Stomachort reduced the formation of erosives in rats with pathology by 4.5 times. Stomachort also activated the immune system in rats in the state of immobilization stress. This was expressed in the normalization of the number of plasma and mast cells in the gastric mucosa. Peptide bioregulators for the prevention and treatment inflammatory bowel disease also is immunoregulatory peptides Vladanix and Cristagen. Vladanix is a complex of immunomodulatory peptides isolated from thymus of cattle, which belongs to the cytamidin group and is protected in the form of dietary supplement, capsules and drops under the tongue. Vladanix has an effect on all links of immune system. It can regulate the ratio of T and B lymphocytes and stimulate cellular immune response. Cristagen or EDP3 peptide as immunomodulator produced in the form of dietary supplements and is an active ingredient of Vladanix. Cristagen regulates the expression of genes encoding proteins responsible for adaptive processes in cells, like CD40, HSPA1A, and some interleukins genes. So we can do the molecular mechanism of immunoprotective peptides action Vladanix and Cristagen in form of scheme. These peptides can regulate gene expression of some interleukins and after that can normalize the immune cells function. So we can do the scheme of peptide bioregulators application in the complex treatment of inflammatory bowel disease in dogs and cats. At the first month we can use Hanluten and Cristagen, and in the second month Stomachort and Vladanix. So the next point of our lecture is oncological disease in dogs and cats. Near 25% of dogs worldwide develop a form of cancer during their lifetime, and near 15% of dogs over the age of 10 develop cancer before the end of their lives. For cats and dogs, very important goal is treatment some types of lymphoma, breast tumors, bone tumors, skin cancer, and oral and nasal cancers. Oral and nasal cancers are very common in cats. The use of peptide bioregulators in the complex treatment of oncological disease in dogs and cats. Since oncological diseases is most causes are associated with impairment of immune system functions, the use of Vladanix and Cristagen peptide bioregulators will increase the activity of T and B links of the immune system and the resistance of the animal's body to the progression of tumor growth. Previously, in studies on small laboratory animals and in cell cultures, it was shown that Vladanix, Cristagen, and Hanluten can slow down the growth of various types of cancer cells, like as Burkitt's lymphoma, Saddle's hepatoma, and other. Unique peptide bioregulators that normalize the function of neuroimmunoendocrine system, has an oncostatic effect and increased life longevity in various animal species in the experiment by 32 persons. in the polypeptide complex of the pineal gland and the lutein. So we can do the scheme of peptide bioregulators application in the complex treatment of oncological disease in dogs and cats. The constant use of the peptide bioregulators is combination with standard therapy will prevent tumor growth and maintain a stage of remission. At the first month, we can recommend use honlutein and cristagen, and in the second month, endolutein and fladonix. The next point is kidney disease in dogs and cats. Chronic kidney disease is often the result of degenerative changes in the kidneys, which are difficult to diagnose in the early stage. About 3% of cats and 2% of dogs suffer from chronic kidney disease. Nephron damage associated with chronic kidney disease is usually irreversible and can progress. Chronic kidney disease is the leading cause of death in all the dogs and cats. In small dogs and cats, kidney disease occurs on average at the age of 20-14 years. In large dogs, chronic kidney disease can be diagnosed at the age of 7 years old. Since renal replacement therapy, dialysis and transplantation has not become widespread in veterinary medicine. So the treatment of chronic kidney disease in dogs and cats is focused on early detection of the disease and the use of renoprotectors aimed at slowing of the progress of loss of nephrons. Pilotax is a complex of polypeptides obtained from the kidney parenchyma of young animals. It has a selective effect on kidney cells, normalizes metabolism and function, and regulates the urinary system. Pilotax is available in the form of dietary supplement and can be used in dogs and cats in the form of drops or capsules. Pilotax has a selective effect on kidney cells, normalizes their metabolism and function, and regulates the urinary system. Pilotax can show high efficacy in a clinical trial in middle-aged patients with gouty nephropathy. It improved well-being, normalized sleep, reduced the frequency and intensity of pain, improved laboratory parameters for blood and urine tests, activates the metabolism of kidney tissue, and enhances their secretory function. So other peptides of again is hepatoprotector, then can slow its effectiveness as nephroprotectors in aging and kidney pathology of various organs in experiment. Avagen activates cell growth by reducing the expression of proteins of aging such as apoptosis proteins P16, P21 and P53. Avagen increases the expression of the proteins of young sirtuin-6. Although Avagen has a nephroprotective effect in experimental model of gentamicin nephropathy and ischemic reperfusion injury to the kidney in rats. Avagen prevents the development of oliguria and azotemia, reduces potassiemia and sodium excretion, has an antioxidant effect, and normalizes the energy supply of kidney cell. The effectiveness of Avagen and Pilotax in the model of cisplatin renal insufficiency in animals has been shown. Pilotax and Avagen normalize diuresis, creatine concentration in the urine and its excretion, glomerular filtration rate, and other parameters of kidney function. So we can recommend use Pilotax lingual and Avagen lingual during 2 months. The combined use of these two peptide bioregulator will help maintain not only the kidneys, but also the liver. Hepatoprotection is very important in nephropathies as it can provide compensative detoxicant support for the animal's body. And the last one is disease of the musculoskeletal system in dogs and cats. They most often occur in old animals. The most common osteoarthritis, discopathy, discospondylitis, osteodystrophy, and some other pathologies in many dogs and cats. Hip dysplasia is the most common disease in large breeds dog. This is a hereditary disease that manifests itself during the period of active growth of animal. Central Asian and German Shelters and Labradors are particularly subscribed of this pathology. The risk of hip dysplasia increases with impaired nutrition, poor quality dry food, eating exclusively meat, and with an incorrect ratio of calcium and phosphorus in the diet. As a result of development of the disease, cartilage is deformed and destroyed. The joint is destroyed and a significant pain reaction is observed in dog. So we can protect of the use peptide bioregulators in the complex treatment of diseases of musculoskeletal system in dogs and cats. Sigumir is a polypeptide complex obtained from the extraction from the cartilage and bone tissue of young animals. Sigumir is a dietary supplement that can be used in dogs and cats in the form of drops or capsules. Sigumir in humans is recommended for the prevention and maintenance therapy of diseases of the musculoskeletal systems, such as osteoarthritis and osteoarthritis, rheumatism, and osteoporosis. Cartalax is a part of Sigumir and it is active principle of this polypeptide complex. And it also be produced as a dietary supplement in the form of capsules and drops. In two experimental models of traumatic fracture in old rabbits, the reparative effect of the use of Sigumir was elevated. On the 28th day after the application of Sigumir, the formation of a complete bone was observed. At that time, the bone defect persisted in the control. Under the influence of Sigumir, bone formation was observed in the third week of the experiment. In the control, this process was longer. In another experiment, the development of post-traumatic osteoarthritis in rats was modeled. On the 28th day after the experiment, the cartilage tissue structure was restored under the influence of Sigumir. So, we can recommend to use at the first month Cartalax and Cristagen, and in the second month Sigumir and Vladanix in the complex treatment of the disease of the musculoskeletal system in dogs and cats. Thank you for your attention.